Today, I'm joined by a visionary in Caribbean healthcare, Dr. Surendra Persaud, co-founder and director of Caribbean Surgery, Inc. With a background rooted in surgical excellence and a passion for transforming healthcare delivery in Guyana, Dr. Persaud has helped shape CSI into a modern, patient-focused institution. From his training at the University of Pennsylvania to his leadership in regional medical innovation, he brings a wealth of insight and experience. Dr. Persaud, it's a pleasure to have you with us. Good
Good
morning.
morning, all. Good morning, Rita. Thank
Okay.
you very much to the Canada-Guyana Chamber for extending this opportunity to me. It has certainly been an interesting path. I left Guyana in the 80s, came up to the United States, college, medical school, surgical residency, returned to Guyana in the early 2002. And most people, that was a dark time in Guyana. It's been an incredible experience. I was the first surgeon to do laparoscopic surgery in Guyana. And when the dialysis center started, I was actually the only person there who was able to put in dialysis catheters and worked along with a number of centers, including Dr. Dubé, who's Canadian, to help set up that center he has in Annandale. I am in New York today with my wife and children because my daughter is about to start her path at University of Pennsylvania, where she has been accepted in a path in biochemistry. So we're here in typical Caribbean style to settle her in and make sure she's off.
We have what we call rapid fire questions, and they're little
Sure.
personal insights from you. Do you mind if we ask those before
Not a,
you? Oh, great,
no, not
great.
at all.
And
Not at all.
congratulations to your daughter. That must
Thanks.
be exciting and sad because she'll be away from home for a few years, but it's for a good reason.
I told people this was 18 years under planning. She'll be 18
There
in a
you
few
go.
days.
All right, let me start with my rapid fire questions. The first one, what's the one surgical innovation you're most excited about right now?
I think the most exciting is AI and what we're able to do. One of the challenges in healthcare is being able to reach out in remote areas. The combination of when you have adequate internet backbone, and we have been doing this for a while, but it has gotten to the stage now where with automation, robotics, AI, surgery will be able to reach into areas that it couldn't, meaning you can set up an operating suite, but the surgeon, which is the most limiting resource, doesn't have to be physically there. Mm-hmm. And I think that areas such as in the military and other things will use this in the beginning. There will come a time when an appendectomy that needs to be done as an emergency in a remote area, that person will present to an operating room and there will be nurses and stuff like that there, but the actual surgeon performing the surgery will not be in the room. So those are where I see technology going, is the constant drive towards minimally invasive, enhanced quality through robotics and AI.
If you weren't a surgeon, what career would you or might you have pursued?
There were three careers. So when I went to Brooklyn College, I was doing quite well in physics. And I was actually being encouraged by the physics department to pursue it. And I said no, because my personality was, if I was going to pursue physics, I would possibly pursue nuclear physics, and I would possibly be in trouble at this stage because of mischief. My second was to be an astronaut, and my third was going to be a surgeon.
But they all seem to have a common thread where you're doing for others. Your talents are giving back.
One of the sad things I feel about healthcare today, and I've tried to say this to students, I remember the first time as a surgeon, we obviously put our hands literally inside persons' bodies. And I have said to people and my surgical students that I train to understand what a privilege it is to do what we do. One of the challenges in modern medicine is that I think most students do not appreciate the privilege that another human being gives you. To put it in terms that people will understand. When you are doing surgery, you're touching parts of a patient internally that even their spouses don't. It is tragic that we don't recognize the trust and the privilege that is.
My next question is one word for you that describes Caribbean Surgery, Inc., and then expand on the word.
Innovation. I remember when I first came to Guyana and I started my practice at Mercy Hospital. And I said to them, I will start at 8:00. And they were like, well, people come there from 6:00 in the morning. I said, no, there will be no need to do that. Everybody will see me by appointments. It's insulting to the patient to have them queue up there. And they all said to me, no, Guyanese don't make appointments. I'm like, yes, they do. That was 20 plus years ago. If all goes well, by the end of this year, we will allow a significant portion of our patients to make the appointments on their phones from the comfort of their bedroom, fill out all of their cloud data that they need, and make payments. Now, that might seem normal for the developed world, but for Guyana, it is not there yet. I've had the privilege to be involved in the development of minimally invasive surgery in Guyana and pushed a lot of boundaries there. But healthcare is an ever-changing field. So innovation is how I see Caribbean surgery, is always there to lead and to show what can be done.
I think that's a really good segue into our first official interview question. I'd like to ask you, at what point did you see AI as the catalyst for change for Caribbean Surgery Inc.?
Now, what we want technology and what technology has failed to do is to predict who is likely to develop this. Diabetes, hypertension, obesity, and hypercholesterol. So a significant portion of the population walks around without knowing they have high blood pressure. And high blood pressure, diabetes, these are things which we have very simple tests for. And so where I see technology in general as helping is that you are going to be able to screen larger groups of patients based upon data collection and be able to reach out to those persons to say, hey, you may be at higher risk for A, B, C, D, E. At the end of the day, the human being gets to decide, do they want to act upon that? But right now, we are unable to deliver to the masses a proper preventive. So you come in. Most people only want to come to a doctor. It's not something people look forward to. It's a very scary experience. And generally, people are coming in to get something done. Wouldn't it be nice if when you came in and whatever that interface with the healthcare facility is, you have had a document which could be 5 to 10 pages where you've revealed everything about your life. And the AI compares that to its data set. And then it says, hi, based upon who you are, your ethnicity, your genetic background, your age, your gender, and your lifestyle, we believe these are some of the areas you should focus on.
This kind of segues into the next two questions we want to talk about. You talked about predicting patterns with using AI to project or to speculate what I might potentially illnesses that could happen with me or with patients. Can we talk a little bit about in the healthcare system, the tools that you're using and the data management side? Because with AI, there's a lot of talk around data security, good data as opposed to hallucinations, things like that. So if you could tell us a little bit about how that works in the healthcare or in your business, your company, doctor?
Wouldn't it be great if anytime we know what are the risk factors. So imagine if on an AI level, it can surveil a population. And we've got the databases. If you think about it in Guyana, we're about to vote. There's a database that knows where everybody is. Some of that database actually has what your profession is. Imagine if we could use that database and now add the database of where the government this year rolled out blood tests. That is being fed back into a system. And the AI, we can pull out the names if we are necessary, but we can have a way of making this data available. So the AI looks at it and then, okay, Surendra Persaud has a secure way of logging into a national database. And when Surendra Persaud logs in and goes through all of the necessary authentication, it can say, hi, Surendra Persaud, as a 50-plus-year-old Guyanese of Indo-Guyanese descent with this risk factors and this, we have looked at your blood tests and your thing, and we believe you should be curious about the following. And here are your risk factors for cardiovascular disease. Here are your risk factors for colon cancer, prostate cancer, and we would suggest you do that. And if you'd be so kind, when you have done that, upload it into our system so we can keep you informed. That's where I see AI as a public health and where it can really change the landscape. AI in the private sector space will do the similar things. So we're not there yet because we would have to have a whole different level of, but the idea behind the whole concept of an electronic
Mhm.
health record
Mhm.
is that Rita comes in today because she's having a headache, but I torture Rita by having her fill out a 10-page document about everything she's done, where she has traveled, what she has done, all of her experiences in life. And then I say to her, she gets an email, please, we have a data check for you. And oh, by the way, based upon your age, based upon being a woman, we would suggest that you have this, this, and this. And by the way, we've looked at your tobacco or no tobacco, your alcohol, your driving patterns. And that's where, on a personal level, AI then, and that's where the private sector would use it, because we're going to use it to drive business.
Right.
But we're also using it to enhance the interaction between us and our patient.
And I'm also assuming that the data you're collecting from your patients is really controlled and kept within CSI, I would imagine, right?
Yes.
Yeah.
So we have, in the United States, we have something called HIPAA laws. In Guyana,
Mhm.
there is a Fundamental Health Facilities Licensing Act that speaks to that. And yes, so whether it's held on servers, how we control access to it, there is that, yes. And I think that that is always a concern, should always remain a concern.
Yeah.
And how that data is secure has to be part of the conversation.
Can we talk about can we kind of change direction a little bit and talk about what are some of the biggest opportunities right now that you could foresee, or not now, but in the next 5 years for Guyana and AI and in healthcare?
So as an individual, I have always said there are three things I would invest in Guyana: healthcare,
Yes.
agriculture, and education. When we look back at this a decade from now, AI would have been most useful in what I call the democratization of education. We have gone from when I was a student in Queen's College, where we did not have enough textbooks. So we would actually share textbooks. Sadly, I had to witness that the other day with my daughter when at a certain point in time. But if you think about it, why on God's green earth are we still printing textbooks? It makes no sense. Every child should be given an electronic device and the government should download it on that. That's the side. So that's one way in which technology. However, when you look at what Khan's Academy and AI are going to do, the child in the most remote location in the planet who has internet access will be able to learn basic English, basic maths, basic any language. And so for me, the greatest achievements in AI will be in the spaces of education. Agriculture, Guyana specifically is currently and will in its future be unable to attract labor, because who wants to go toiling into the sun using pitchforks and watering plants? And so AI, with its automated technology, it hasn't played a role, but it is in the near future will play a significant role in agriculture. Healthcare, and I will push the envelope on this. If you're not touching the patient, the first step is you do not belong in the building. The second step is that the AI and automation will compete to sort of remove tasks. What do I mean by that? So the AI is going to look at you. It will see that you made your, let's say, a woman made an appointment to have her breast exam, or the male went and had his prostate evaluation, and it will know when you did that. It will know what the science says should be the follow-up and the repeat. And it will make the appointment and it will drive you to it without you having been bothered by it. And so the AI will remove the, oh, I forgot the appointment, the forgetfulness. The AI will hum you. Today, AI, as we're all seeing it, it is getting to the point where it is invading us in a very, very, you cannot open up an email today without the AI having read your email. You cannot do a search without the AI saying, here is where I like. ChatGPT just released 5, which is incredible.
Incredible. Yeah.
And so how much user interaction will be needed? And what we're saying is that going forward in a rather rapid fashion, the AI will observe the user and automate the processes.
Okay.
That is both interesting and scary.
Let me ask you, what advice would you give young or anyone really wanting to get into the medical, they're starting their career and considering going into the medical field of study? What advice would you offer them, or would you say to them?
Pursue a career that you want to do. I've had enough doctors, pharmacists who have quit because mommy and daddy wanted me to do that, and I
Right.
don't want to do it. We all have personalities. So the first thing I say to everybody, figure out what your personality is, whether it's 64 or 16 or 4.
Mhm.
Figure out what your personality is. And then the second question is, do you want to work for yourself or do you want to work for somebody else? I could not work for somebody else. I would be fired on day 2. I'm too opinionated, too arrogant to be able to do that. My personality is the type of person that I will see, I will see the forest, but I will miss the trees. I am many times so focused on the direction I'm going in, I don't really pay attention to obstacles because I will solve them along the way. That is a unique personality. So I've said to people, let's take medicine. If you decide you want to do medicine, you may feel that certain personalities, but take into consideration this. There's a doctor called a pediatrician who spends his entire adult life listening to screaming children who have no way of communicating their problems to him. He touches their abdomen, they scream. He touches their. I mean, I remember taking my children. You've got to have a unique personality. There is a doctor who sits in a dark room and looks at images all day. They call him a radiologist. That's a different personality. There's the pathologist who looks at, never sees a patient, sees dead tissue. There's the microbiologist who looks through a microscope. There's the surgeon. There is the family practice doctor who wants to develop a lifelong relationship with a person. Those are all different personalities. So I say to everybody, understand your personality, question 1. 2, understand, do you want to work for yourself or do you want to work for somebody else? And then that should be what you are drawn to, because if and it's going to become worse going forward because you are going to be replaced rapidly and you're going to be very unhappy. I've never really considered what I do work. Now that presents a problem because today when people speak about work-life balance, I scoff because I don't understand it. But yeah, that's my advice to people is understand your personality. Decide if you want to work for yourself or you want to work for others and do something you enjoy. You must feel passionate about it.
So it's not really for the medical, but it's just for everyone. Do a self-assessment. Yeah.
It's for everybody.
Aldercy and Radha, do you have any questions or comments for Dr. Surendra?
No, I think you've both covered the questions. Rita and Dr. Surendra has been very informed and knowledgeable on these topics. So the entire conversation was very insightful, and especially with the medical aspect, it was great. So thank you, Dr. Surendra.
You're most welcome.
Aldercy, how about you? Do you have any questions?
No questions from me, because I did kind of have a synopsis of the conversation before with Dr. Surendra. Like, I often tell persons that he's like an advisor. He's like I don't know if to say another dad or another grandfather. I don't know the age, but
no, I think he's a
it
bit
was
of
wonderful
everything.
to speak and to listen.
Dr. Persaud, last question. Caribbean Surgery Inc. I know where it's at. I was in your office. We had a chat there as well. Can you, for our audience that will be listening to this, both in Canada and in Guyana, can you this where you are, your services, just to bring it home with that last final question for us, please?
So Caribbean Surgeries, the plan is to continue to expand within Guyana first, and then expand beyond Guyana, just using AI and technology because we will need that to help on the financial part to be able to expand.
I can't wait to see it all come together. Maybe I'll be back in Guyana next year and come and visit. Dr. Persaud, I'm sorry we've gone a few minutes over, but it was so well worth it for us. I hope it was okay with your family. We want to thank you for sharing your time and your insights and your passion. I mean, listening to you, it's not just life lessons, but it's education, it's personal, it's so much culminating into your mind coming out and sharing, and your time. We absolutely know how critical it is, and we thank you for getting this 45 minutes this morning. So thank you, and we can't wait to share this interview with you in the newsletter.
Yeah.
Okay.
Thank you very much.
All right, bye-bye.